share their areas of expertise, and we'll also like to thank our participants who are taking the time to be here with us today. Knowing that we're in the midst of a global pandemic, we know that the disease burden is definitely challenging in our communities of color and those that are experiencing poverty. And so we want to make sure that we move the conversation forward and share the urgency that's needed in moving this work forward of racial and social justice. We do want to also share and shine a light about how us as community partners and health centers across the U.S. Are helping to build awareness not only for today, but also for the future. So as we get started, and I just did our welcome, just a few general reminders for the group here, all our panelists and our participants. This is an open dialogue, and we appreciate, again, the leaders and the community members who have been who have participated with us today, and the various leaders of our sectors. We do have limited time, so we only have about 90 minutes today together. And normally we would ask our participants to contribute to maybe the grounding rules or the settings that we would hold each other to in this space. But for the purpose of our discussion today, we're asking for everyone here to be honest, to listen actively, to avoid any comments that may be harmful in any way or hurtful to others, and then to also speak from your own experiences or those which you have the permission to share. Another thing to note here is that this webinar will be recorded, and the link will be shared with all participants, registered participants, after today's discussion. Throughout the discussion, if you have any comments or questions, please use the chat box feature so that you can be an active participant or engage with our panelists for today. We also welcome all of our participants to have their videos on if you feel comfortable. If not, feel free to turn that off. And also, all participants by default will be placed on mute. One of the other things that we'll like to highlight here is that Neighborhood Health Center really does value the principles of the trauma-informed care approach. And so understanding that today's conversation will touch on topics that might cause or might highlight some of the traumas that are experienced by ourselves and members of our community, we do want to share these today, these trauma-informed care principles today, to reiterate a universal foundation for treating one another well. This is a principle for organizational change and culture change, but also the way that we treat each other in whatever relationships those may be or interactions they may be, whether it's patient-provider, collegial, other relationships. And so when we talk about safety, it's not only talking about the physical safety of each other, but also the psychological safety as well. When we talk about trustworthiness and transparency, it's clearly communicating what our needs are, what our tasks are, and maintaining boundaries in those ways. When we talk about peer support and mutual self-help, we're looking at lived experiences and promoting well-being and healing with each other. Collaboration and neutrality, we're talking about recognizing power, leveling power, and then sharing power with those consumers and with each other as well. Empowerment, voice, and choice, we're looking at the uniqueness of each of our experiences and the approach that we have to those same experiences. And last, of course, but not least, is the cultural, historical, and gender issues. And much of our conversation today will probably highlight some of these issues, healing and breaking down stereotypes. And those could be biases based on race, ethnicity, sexual orientation, age, geography. And that's for the past, and that's for also the present and future. So if you do have more questions about these guiding principles, feel free to reach out to the Institute on Trauma-Informed Care, Trauma and Trauma-Informed Care, ITIC, which runs out of UB. I know that some of the partners around the table are also experts at this as well, so we encourage kind of sharing the resources for that transformational change of organization. So as we get started, we're going to take a brief moment to just open and create our intention for this time today. In the chat box, and we encourage all of our partners, participants to use the chat box feature here. Please go ahead and type your name, organization that you come from, how you heard about this discussion or conversation today, and then if you want to share one hope, what's your best hope for this time and this conversation? It could be an action, it can be an idea, or a lesson that you're learning, you're hoping to glean from one of our panelists today. We'll give you a couple of seconds to do that. Feel free to share. Without further ado, I will go ahead and introduce Joanne Hafner, CEO of Neighborhood Health Center, who will be moderating today's discussion or conversation. A family nurse practitioner by trade, Joanne has more than 25 years of experience in healthcare and has a sharpened vision and focus for promoting the health and wellness needs of our communities. So, Joanne.
Welcome, everybody. Thank you so much for being here. It's an incredibly important week for us. This is National Health Center Week. It's a very important time in the history of federally qualified health center. It's our opportunity to spend a week highlighting that healthcare is a choice that we want to provide to everyone, that it is open to everyone, and it is something that is a right for all people. And it focuses on our history in social justice. And so that's one of the things that made it so important for us to have this conversation virtually this year, since everything is virtual. So I just want to welcome you and thank you all, and understand that every person who's here is important, and we really want to share this community opportunity. So I just want to take a minute to introduce our really expert panelists. We're thrilled to have them all. We're presenting them in alphabetical order, so no preference to anyone. I love them all. Our first guest is Broderick Cason. He is actually the Community Engagement and Program Manager for Univera. He is an icon in this community for helping people to see that there is a health insurance plan that is affordable. He also gets the brand out there, but he's also a volunteer for many organizations helping to promote equity and community engagement. Next is Fabian. She is the Associate Vice President of Harm Reduction at Evergreen. In her position there, Emma oversees harm reduction and drug user health services at the sites of Evergreen in Buffalo and Jamestown. Our next guest is Dr. Ellis Gomez. She is the Family Medicine Department Chair for Neighborhood Health Center. She is a well-respected provider in our community. Dr. Gomez has over 25 years experience in medicine. She particularly has focused her practice in the city of Buffalo on Buffalo's Lower West Side. Dr. Gomez has focused her entire body of practice on caring for diverse, multi-generational families in our community. Our next guest is Dr. Ellen Grant. She is the Deputy Mayor for the City of Buffalo. She's a Buffalo native, and she has a background in nursing, social work, and therapy. Dr. Grant's resume is over 25 years experience in government, nonprofit, and academic sectors. As our Deputy Mayor, she's put through many public health policies that marshal best practice for addressing inequity and advocating for initiatives that bolster economic opportunities across our city. Our next guest is Joelle Hackett. She's the Equal Employment Opportunity Program Director for the Veterans Administration Western New York Health System. She's fairly new to Western New York, but she's committed to using her skills in training and consulting in the areas of equal employment, leadership development, retention, career development, and cultural competency to support the underemployed and lower economic folks in our Western New York region. Our next guest is Brandy Loveland. She is the Director of Community Engagement for the Erie County Restorative Justice Coalition. Brandy's work is in promoting and advocating for justice, empowerment, equality, and restorative practices in our Buffalo public schools. Brandy's work with youth has led her to work in holistic after-school programming, which run out of our community schools and community centers. And finally, Dr. Raul Vasquez. He is a very well-known icon in this community. He is the CEO of Health Enterprises. He's a recognized leader in innovations in delivery for healthcare. Dr. Vasquez is committed to health and wellness in our community and has created a significant paradigm shift that continues to inspire real change in healthcare delivery in Western New York. He has had numerous awards for the work he's performed, especially on the Lower West Side. Dr. Vasquez's Health Enterprise umbrella, his organization consists of GBON and Jabaco, which are affiliate organizations, as well as the Urban Family Practice that he is the founder of. I'm going to open up an opportunity for all of our panelists to add any additional thoughts as we begin. Panelists? All right. Without further ado, let's start with our conversation. Actually, before we start, we're going to stop screen sharing so we can actually see each other a little bit better. And if you have the opportunity, you can go up to the corner of your screen and hit gallery, so you may be able to see more of the participants who are here on the Zoom today. The first question that I have for our panelists is, so what does health equity, racial equity, and social justice mean to you, to your organization, and the work you do here when we reflect on the occurrences and the landscape of health and healthcare in 2020? Why is this conversation important? And in what areas have your organization and you made a shift already because of the things that have happened this year? This is for all of our panelists, so I'm just going to go in the same order that I did for introductions and start with Broderick to kick us off. You're muted too well, Broderick. You're with us now.
I am. Hello, everyone. I guess hearing about ICON makes me realize I know more people on this call than I anticipated. I guess I've been around for a while, so I'll have to try to live up to that, Joanne, but thank you for the introduction. So as you all know, I've been around a while and doing work in the community in a lot of different aspects of the community. I've been fortunate enough to actually, in addition to healthcare, to work in another space that I'll just quickly mention, which has to do with live entertainment. And the reason I bring that up to you is because what I found the similarities in healthcare and in live entertainment is that some of the instilled needs that we have around social justice and equity involves and evolves around all different industries. So there's very much that we have to talk about that we have in common around this idea that we could do better. So in my role, I've always attempted to do better. For me, this isn't new work. So I want to be very clear that this idea that the unfortunate death of George Floyd and other things that have happened recently over the last several months, I find very interesting that it stirred a conversation, which is a good thing. It's also stirred direction in people wanting and recognizing that they can do better. But I do want to again go back to the idea that this isn't new. And for many of us, we championed the idea that people should be treated with respect and dignity across the board. And I would liken that for all of you to think for a moment around the idea that if we take all of our best intentions and bring them down to the very basic rule of thumb, which is the golden rule. And if we teach each other and we practice the idea of treating each one of us the way we want to be treated, and we begin to think about, which is what I don't really have to do, but I challenge myself with doing, anything I'm going to say or do that I ask myself what I want done to me, pause about that, or if I have to rethink that approach, that tells me that what I'm about to do probably isn't the best road to take. So I think if we think about the golden rule as the overarching way that we conduct our lives, we probably wouldn't be having this conversation today. So I would offer that in all of our work, my work, and I hope many and every other person, that we would kind of lead our work around that. And as I look at the folks that are listening today, many of you know that we've had conversations directly around some of this way before, which is why I emphasize this is new. And so I also, as it relates to work, have to say that I've been blessed to work for employers who innately believed in what I just described, and that I've been fortunate enough to have mentors. Leslie Land, and I'll have to call her out, is in the audience today, and some others of you who have, or her daughter's smiling, who has been leaders in this same kind of thought process. So for me, I was always encouraged in my work to identify areas that we could do better as a company, call it out, ring the bell, and not just do it for lip service, that the company would then wrap its arms around some sort of change, be it how small it might be or how large it might need to be. So I, going forward, as I get older, recognize that some things you have to just take a stand on. So I would not work for a company that does not do that. Frankly, I think it's hypocritical to work for a company. If you feel that way about it, and feel strongly about that way, then you need to match up with an organization that champions your beliefs. And I've been fortunate to have that happen. So for the Univera world, we've always championed the people who are less likely to get care and service as it relates to health diversity. Joanne, the creation of FQHCs, in part were for that very reason, so that we made sure that healthcare was equitable for everyone. So over time, I've witnessed this idea that we can do better and that we aim to do better. But as we talk about real conversations today, we also have to recognize that people of color and people who have been ignored or haven't had the same opportunities have sort of heard this "we'll do better" sort of banner before. And I think it becomes harder and harder to prove our intent if each time we intent, it sort of gets knocked down and people don't really take it to the degree that they should. So I'm really hoping that going forward, this won't be just another one of those plateaus that we find ourselves on, and then we find ourselves backpedaling. Because make no mistake that this whole George Floyd and other things that have happened, make no mistake, will go away and we'll go back to business as usual. I will leave you with the thinking about this. Because we're at home, because our lives have slowed down in some respects, we have more time to focus on some of these things. But I would argue that had our COVID situation had not occurred and the George Floyd situation happened, I'm not quite sure we would have wrapped our arms around such a groundswell. So that being said, sometimes with crisis comes opportunity. And due to the fact that those two significant things happened at the same time, they impacted and impelled us to begin to focus on something other than ourselves and other than our work and other than our busy life, that we could be involved. All the young people you see involved, the groundswell where they're not thinking about school, they're not involved, they've been home, they had something to wrap their arms around. So we must take this time to do all we can for the opportunity that I believe we've been given. We didn't ask for COVID, but if you look at the benefits of how that might help us, we've been almost blessed in a sense to be able to be given an opportunity to move forward in a way we've never done before. And I believe, I'm going to trust and believe that we will and can do better, and that this time it'll be more than a notion.
Great. Thank you, Broderick, for kicking us off with such an inspiring first thought. I'm going to move right to Emma and give her the floor to answer the same questions.
Wonderful. Thank you so much. I'm one of those people who's known Broderick for decades. And so, you know, if somebody would have told me 25 years ago that I'd be talking on a virtual panel discussion with Broderick about health equity and social justice, in some ways I probably would have said, get out of town. Like you're you know, that's unbelievable. And then also in some ways I'd say, okay, that's probably in the cards. Because I think what a lot of us know on the call today is like work about health equity and work about social justice is a lifetime's work. And this isn't just a moment in time. It's really a milestone for what's a lifetime of work for a lot of us. I work at Evergreen Health, and for those of you who don't know, what is now Evergreen Health used to be AIDS Community Services about 30 years ago. And so our roots are in the HIV and AIDS movement. And now that people in general live longer, healthier lives with HIV, we have expanded to serve a variety of populations, particularly like a lot of folks on the phone, particularly people who are underserved by the healthcare system. So we take care of about 14,000 patients every year. And I oversee our harm reduction programs. It's kind of an alternative approach to providing services to people who use drugs. In a lot of ways, it's relevant to the conversations that we're having today, because harm reduction recognizes that people have different backgrounds, people of different races, of different identities, of different lifestyles, you name it, have different access to healthcare services and different access to having their basic needs met. And so harm reduction, although it's been part of our mission at Evergreen Health for years now, has become in some ways more relevant than ever before. And then the other thing that's you know, on my mind today about the work we do at Evergreen Health is that the Pride Center of Western New York and a group called Community Access Services, which primarily works in communities of color with a staff that's entirely composed of representatives from that community. Those are all big parts of our organizations. And so when it comes to how health equity and conversations about social justice and racial justice are impacting the work we do, I think what a lot of folks on the call today will appreciate is it's not just impacting our work, it's always driving our work. These conversations and these social determinants have always been driving our work. And one of the reasons why I'm really happy to be here today, and I wish I could honestly be a part of this conversation every single day, because we know a lot of conversations in healthcare don't focus on these important principles and themes. So, you know, one of the reasons I'm happy to be part of the conversation today is because I think as health centers, it's our responsibility to keep this conversation live. You know, as I mentioned earlier, this isn't just a moment in time. This is like a just one milestone in a long movement. I think that COVID-19, our country's reckoning about racial justice, and the work that I do responding to the overdose crisis. I'll mention we're in what seems to be probably the worst wave of the overdose crisis ever here in Western New York and in Erie County. These situations have shed light on inequalities in such a way that if we're doing our work correctly, it's going to be impossible for the rest of our communities to ignore. And I think it's our responsibility nowadays to not just say things like, you know, well, that's the way it's always been, or that's how healthcare works. We have these barriers, we have these parameters around healthcare. This is the way it's going to be. You know, we have a responsibility to not sing that tune any longer. And so that's, you know, that's just what's on the forefront of my mind these days when I think about our role as health centers and how really we should be using these moments as ways to just continue to drive the services that we provide.
Great. Emma, thank you so much. We're going to move right to Dr. Ellis Gomez.
Hello, it's a hard act to follow. The first two presenters shared so beautifully and so eloquently. I think I'd like to just talk a little bit more about the health equity side, which Emma did a great introduction to. And I think having practiced in this Lower West Side for almost 27 years, I've seen a lot of changes, and I think I've lived and experienced a real growth in healthcare for the underserved in this community. When I was a medical student more than 30 years ago, we had very few primary care centers dotted along this side of the city. We could actually count. We had the hospital that was located at this site at the Matina Neighborhood Health Center, but years ago went by different names. We had the Northwest Community Health Center, FQHC, that was probably just a few years old back then. And the only other thing in between the two was maybe a little office where there was one doc or two up Niagara Street across from Tops. So that is what I saw when I was a med student. And I went in and I worked with a doc on one of my rotations and saw that there really wasn't very much for primary care for our communities of color. So where did most of them go? To the ER. And I lived that myself in the South Bronx, seeing family members who went to the ER for lots of different things, from a cold to a heart attack. So it's been wonderful to see how that has grown and changed. Today, we have FQHCs that are growing and blossoming in this side of the city. We have Jericho Road, our neighborhood health center. We have urban family practice groups that are seeing the needs, meeting the needs of a lot of underserved communities of different languages, of different colors, and different orientations. So I think that is something that almost gives me goosebumps to think of, that this has happened in the last 25 years. And I've been a part of that. I think that one of the things I just want to highlight is that Raul and I were classmates. Dr. Vasquez and I were classmates at UV, and we did residency in the same place, just a year apart, and ended up settling down on the same street in the city. And I think that is a great testament to our school and to our training, that we wanted to come back and serve this community. A lot of people have come through our offices and worked alongside us, as well as become our patients for decades. And I think that that's just a privilege that we have. And it's great to talk and be part of this panel. Thank you.
Thank you, Dr. Gomez. I also think it shows the commitment that the two of you have had to the community and in the training of additional doctors in the care and love of the patients we all care so much about. So thank you. I'm going to move right over to Dr. Ellen Grant for her opening comments.
Thank you, Ms. Hafner, and your team for putting this program together during National Health Center Week. It's certainly a pleasure to be here with my fellow moderators. I personally am coming from a point of servant leadership. I may be in a leadership position, but my role throughout my life has been to serve others. In my role as deputy mayor, though, it's my job to also help the mayor as he leads the city. And he has always kept at the forefront equity, inclusion, and diversity. And since taking office, some of the things he's done towards this is certainly we have the most diverse leadership team in the city's history. We continue to have investments in affordable housing, parks and infrastructure. Most recently, with the protests for equality, the Buffalo Reform Agenda in the police department are still ongoing. We have affordability programs in the Buffalo Water. the mayor's summer youth employment programs has continued to put our city youth at work so that they can have a sense of independence and not want to turn to negative activity. Certainly the work training opportunities that the mayor has implemented under the Northwind Workforce Center, the Buffalo Employment Training Center, and Beverly Gray Business Exchange Center have spoken to the work that we are continuing to do to make sure that no one is left behind and that no one is left out. So thanks.
Thank you so much for your comments. You are so right that the city and the mayor have not shied away from the hard topics. So thank you for your support of that. I'm going to hop over to Joyelle Hackett for her opening comments and reflections.
Oh, thank you so much. Thank you also for just inviting me, on the panel. I'll keep my comments brief because the comments that have already been made have been so spot on. I will tell you that from my own perspective, I address equity and diversity and inclusion a bit differently than some of my colleagues. I tend to be a bit unorthodox. I do like to come from the standpoint of conversation and relationship. Equity is not cookie cutter. A lot of times we treat equity as if it is a topic that we can cover and then we're covered, and that is not correct. Equity is something that has to be discussed per situation, per relationship, per organization. Equity is not going to look the same in any particular instance. We can speak about some best practices as they pertain to equity, in the healthcare field, equity as pertains to people of color, women, and so on and so forth. We can speak about best practices, but I believe that in this season, it's really important that organizations work with equity consultants and people that do, consultant work as a profession that can go in and really look at their organization and look at the need and really address and come up with a plan specifically for them, and get them involved and get them to own the process and understanding that, I can come in and I can say, this is the problem and this is where the problems are and this is what the people need and this is what your audience or your clientele needs, but you have to own it, CEO, you have to own it, director. And I think that's really important. And as we can tell from this, this panel, there are equity consultants and professionals that are available. And if you don't have one available, it can start off as simple as a conversation. For my organization, I have always had a lot of discussions. Obviously, we elevated it with the murder of George Floyd and with, Breonna Taylor and all the so on, so many others. We elevated the conversation. Why was I able to elevate it? Because there were people that previously were unwilling to have the conversation that now are willing. So I had to strike while the fire was hot. And I tend to have conversations and divide my groups up in a way that creates safety. I believe that when you talk about things like equity and diversity, you have to create safety. And that's the thing that's often missing. When you tell a head of an organization that there are equity concerns or diversity concerns or, any of those things for, a lot of times there's this angst that comes up in them, which can cause them to be rendered deaf and not hear anything you say after that. So it's really important that we're creating safety, that we are, putting value on everybody's voice, everybody's experience. And so once they feel safe, they can then become a part of the solution because they don't feel like part of the problem. And that's just kind of the standpoint that I come from. Equity is obviously very important. I believe it's important that we teach what equity is. The laws have addressed equality. But equity is, discussing the needs of the people that were not considered when those laws were made. So equity is very important. It's going to continue to be important. And I'm just glad to be a part of the conversation. And I avail myself, you know, whenever possible, I really believe that this is my work, this is how I contribute, and this is how I use my privilege. So, and I believe we all have privilege, and, you know, we're all using it during this 90-minute call. So thank you, everybody, and I'm glad to be on the call.
Joelle, it sounded not only like a personal reflection, but a call to action for us, which I can't wait for us to talk more about. I'm going to invite Brandy Loveland to share her comments and reflections next.
Firstly, I would like to thank you for the opportunity to be part of this panel. So far, there have been some really, really amazing points that have been made. Everything that has, you know, reflected some of the things that I wanted to talk about. So I'm going to try to say something a little different, but flows along the lines of what we have been discussing. For Erie County Restorative Justice Coalition, we are a grassroots coalition. So a lot of the things that we do in the community have been reflective of our immediate work directly with the people who we're hoping to serve. So recently, with COVID-19 and with the death of George Floyd, for those who are privileged to have internet, you know, it has been really, really apparent the inequalities that people have faced in the community, and that's that people were able to sit down, especially people who are in a stance of privilege, to realize that they do have privilege. And then what do they do with that? How do they address that in communications? And how do they have these conversations with community to help inform change? So we have found ourselves in a place where we have actually been offering spaces to the community to have these conversations. But not only that, for the people who are underrepresented and underserved, to also have a space to talk about what has happened in their communities. When we think about George Floyd, you know, in the past with, you know, a lot of people have, they have framed it in a way, well, maybe this person did something, which we know is not necessarily, you know, the truth, but that is a reality. In this case, we saw that this person was not resistant, and it's led, you know, us, you know, people of color to have question about how we have long educated our youth and how to be safe when we encounter police or when we are in situations in the community. And so we have also provided and offered spaces for people of color to also have this conversation. It's also led organizations, agencies, businesses to come to us and ask us about how do we support not only our people of color, but all our employees in a way that we could move forward and be productive. And then it's led to other questions about things that deal with COVID and people who are living in poverty level. We have had discussions, you know, that they didn't even expect about chronic health conditions, people who have died from COVID-19. Also about schooling. How are their kids going to get care, and how are their kids going to be safe and get schooling as well? You know, and some people don't even have the option. You know, how are we going to get to testing centers when we're working? How are we going to get this access? And so we have come to a point in our work where we are trying to partner with other communities and other organizations to try to help individuals in the community and also the people who we work with kind of collaborate to try to find solutions to these problems within their community.
Thank you so much, Brandy. Great comments. I'm going to open it up to Dr. Vasquez to round out our first question for us.
Yeah, fine. Thanks for having me. I think for me, it's some of you guys know I'm really radical, very radical. You're talking about an inner city kid that grew up on Medicaid in the projects. So the people that I deal with every day are people that are my family, my brothers, my sisters. Two of my mentors throughout my whole life were my Uncle Joe, who was basically came to this country. And it was almost like an immigrant because you didn't speak the language, the barriers that we had at the time. Another mentor was Willem Elgator, my father-in-law, who did a lot of things on the East Side, really changing people and touching people's lives. So I think I've been very tough in this area, and I haven't always made friends because it was really important for me to really change people's lives. I'm the longest private practice in the history of the West Side. And I'm proud of saying that because the people were the ones that really got me here and kept me here, And it was both of the Black and brown community that have given me the opportunity, for this kid that wasn't even from here, from the Bronx. And I think for me, it's always been a passion to really change people's lives. And we talk about the social determinants of health. Well, we've been talking about it. We've been doing things a lot. It's back since 1996, at least me touching the area, getting transportation, food, and all the things that normally you weren't compensated for, but you wanted to change communities with. I think with us and the way that we were able to kind of change people's lives, my father-in-law said that the only way to change communities with three things, and I spent about an hour and a half, excuse me, with them, finding out what those three things were. And they were jobs, jobs, jobs. I think the more economic healthcare can do, the more jobs we create, and we create about 240 jobs. Those are families that we're touching. Those are communities that are changing. People have to see people that look like them doing things, people that look like them treating them. And I think there has to be a change. And I'm hoping that, at this stage of my life, I thought we had a Black president, things were changing. And then it's been a horrible, horrible time in terms of everything and I'm a full-fledged Democrat. I don't believe in the way the country's going. I think if this continues past this point, we could be in a civil war like never before because, Black and brown lives really don't matter in this area, in this country, if that occurs. And so I just think that healthcare, we can change people's lives. I think partnering, especially during the COVID time, was crucial. I think really going out there and not being scared and changing people and touching people, because there were so many people that didn't understand. And the thing that broke my heart up here that was down in the Bronx area where we had 3,700 people that died at home because they didn't have any type of connection to healthcare. And I think because of the people around the room, Buffalo was well served in terms of touching people's lives and really changing outcomes. So it wasn't as bad as it could have been because of the services around the table. So I think as things evolve, it's really important for people to really change. See, the young lady was talking about digital divide. There is a digital divide. There's no internet in some cases. It's affecting education. It's affecting healthcare, for us to kind of develop medical neighborhoods. And, I'm a private practice, you got to have QACs. We have to find ways to collaborate. We have to push for more doctors. This year was one of the most proudest times of my life. And I'll tell you why. Because both my daughters are at UB Medical School. And so I've got an army of V's that are coming. And I just want to grow more and more of these community. We got to get more of our kids into the area. We have to admit more Black and brown populations into the medical schools if you want us to really do a lot of good things. But the leadership, what I liked about this group is it's diverse. Every time I walk into a room, I'm usually probably the only person of color. And that has to change if we're gonna, I always say the eyes can only see what the mind knows. And sometimes if we don't have enough of us in the room, you can't really, change. We won't have the appropriate change that's so important. That was it. Okay.
Oh, Dr. Vasquez, you say radical. I say impassioned. Like you really show a lot of passion and love for the people that we all serve. So thank you for rounding out our first question so nicely. I'm going to move right on to our second question. These are about 2-minute comments from, and this question is for Dr. Grant, Joyelle, Brandy, and Broderick. You all focus on cross-sectional collaboration, so I'd like you to reflect on how important that is now, but how you see it increasing and how you see the areas that we need more of this kind of collaboration to solve the problems we're talking about. Also, what are the important conversations that are occurring right now? We're going to start with Dr. Grant.
Okay, thank you. So the mayor has, certainly the George Floyd and the street protests have put this front and center for the mayor. And so he's been working with a number of civic leaders, community leaders, grassroots organizations from healthcare also to higher education, media, philanthropy, to work on the systemic racism that we see in the city of Buffalo. We know the time for action is now, and so we've been taking steps to ensure that Black residents and people of color, actually all residents, feel safe throughout our city. So that's really the short answer. We're continuing to meet with anyone that really wants to reach out to us for any kind of coalition building. I myself am serving on the University of Buffalo's own racial equity agenda, so to speak, to look at how we can bring the university more front and center to being a core function of the city. We know that the Buffalo campus is right in the neighborhood, and they haven't always been a good neighbor, so we're trying to work with them to make sure that they are reaching out to be more inclusive to not only with the neighborhood, but also for the university to take an introspective look at the number of faculty of color. How are they working with their students of color to make them feel safe and admired and respected as they continue their scholastic work.
Well, thank you so much for that. I'm going to hop over to Joyelle to talk to us about cross-sectional collaboration. You are heavily muted.
Mute. Okay, unmute. I said, I was thinking so much about the collaboration and hearing the comment. Can you tell me that last part of the question that you posed?
Sure. Have other conversations already occurred, and what's missing?
Okay. All right. Thank you so much. So I think what's missing is collaboration. I think that is the conversation that hasn't occurred, is how can we pool together our resources and our expertise? If a conversation concerning equity and, diversity and inclusion and, anything that benefits, underprivileged and people of color and, people that are underserved, if those conversations are happening, I want to be a part of them. So we need to share our resources and we need to pool together our privilege. Everyone that's on this call, I speak a lot about privilege because I try to empower everybody to understand that we all have it. For those of us that are educated, for those of us that are not living like so many that are in Buffalo, for those of us that do have access to education for our children and technology, for those of us that have the skill sets and the expertise that we have, that's privilege. And what we do with that privilege will be, we will be able to expand on it and get a better return on our investment if we collaborate. I often say, the slaves didn't free themselves. They didn't do it alone. You know, it took collaboration from their white partners. You know, we didn't march alone. It took collaboration from our white partners and people that did not have the same struggle. We have to collaborate. There needs to be more of a, you know, I know UB is doing something pretty incredible. And Dr. Grant, I believe that's what, you know, the organization that she says she's involved in, but they're doing something pretty incredible where they're pulling in, you know, some community leaders in this area and having this conversation on equity. That needs to be expanded. I would love to see it be an initiative that comes from the mayor where, you know, we're enlarging the conversation and get people to the table that are more change oriented versus complaint oriented, and that actually have the skill set to come up with changes and come up with approaches that's going to satisfy, you know, everything that needs to be satisfied. I guess it's my background as a mediator. You know, I'm trained to not just look at it from one area, and I'm trained that the word compromise is not always a good word. I look for the win-win, and the win-win is what we need to be looking at, you know, and so no one leaves the conversation feeling like they've lost something. And so, you know, like you mentioned earlier, that when I speak, it's a call to action every time. Ask my teenagers, you know, ask my teenagers, ask my coworkers, ask my director. It's a call to action. It's how can I collaborate with you? But I believe that that's the conversation that's not happening often enough, and that's something, what we're doing right now on this level needs to be happening on a larger scale. And I believe it is happening. I believe that it's happening and it's siloed all around our city. And if we can bring those, you know, conversations together, then we'll be able to have more actionable items that we can actually, you know, invoke some change.
Great, thank you so much. And we certainly are hoping that that's what today is going to do for us. So, Brandy, can you comment on these cross-sectional collaborations and what you see happening?
So as I mentioned before, we have been partnering with people in the community and other organizations to actually try to inform change. One of our most exciting initiatives that we're working on is with Connect, and we joined their committee of other organizations to try to develop freedom schools in the community. And if you aren't familiar, it is a 50-year-old movement that started during the Freedom Summer when people from New York came down to the South to educate children of color. So we are hoping that we can bring in a program to create a socially conscious and holistic school for system for Buffalo. So we have been holding forums for several weeks now. We're continuing to hold forums to invite youth and parents, community members, and any leaders to come along with us to try to create some sort of program for the Buffalo school community. We have also seen great work with the Buffalo Peacemakers, who have been partnering with the Buffalo Board of Block Clubs to try to bring on solutions to how to have the community work together to inform justice and change. One of the things that they're trying to answer the question with, and we've been, working alongside with them, is as they're working towards defunding the police, what does that look like for communities? And can communities bring up and build up leaders to help work on solutions to help strengthen their communities? Also, we have been working with youth in the community to try to boost a youth arm to allow them to have self-expression. I mean, right now, so many people have had a voice during this time, but not a lot of voice from youth. I mean, even when it comes with figuring out what schools are going to look like in the fall, youth haven't had that voice. So actually this Saturday, there is an event that we're hosting, and it is called Youth Voice, and it's allowing youth to use art expression to express their feelings about COVID and racism. And there are several other collaborations that have been happening in the community, that are great. But I do agree with Joelle, as much change as we are making in the city of Buffalo, it is very siloed here. And, because of that, progress and change is slow. I mean, it's slow everywhere, but it is particularly slow in Buffalo. And, it surprises me too, because Buffalo is so interconnected. Everybody seems to know everyone here. I'm speaking for me because I am not a Buffalo native, but, every time I speak to someone, it's like, oh, somebody from Buffalo. Oh, I know this person and I know this person. So, why can't the city of Buffalo and why can't our communities come together, even though, collaboration can be difficult, work together to try to solve the problems within our community. It is tough, but, many hands make the work easier. Thank you.
Thank you, Brandy. We're going to have a couple of minute comment from Broderick about cross-sectional collaborations. You're still muted, friend.
I'm going to take it from the back end forward, if I may, and kind of talk about the who should be in the room. And I think any organization or any individual that's not having these kind of conversations right now, where are you and why aren't you? And so my answer to that is everyone needs to be in the room. So in terms of who's missing. And so I have uncovered, and the individual Brandy just talked about being new to Buffalo, and obviously I'm not new to Buffalo, so I do fortunately know some of the people who I believe are the movers and shakers, if you will, of the leadership. And so I have championed challenging them to say, what can we do better from the leadership end? I think that all of the things that I've heard are well-intentioned and they're wonderful. And to Dr. Vasquez's point that when you're the only one in the room, it makes it a lot tougher to make those agendas move forward. I think we're getting better, but I think at the end of the day, we have to have decision makers who are of color, who are making those decisions, who are part of the change that we need to trickle down to the others. Bottom up in this world that we're talking about today just doesn't really work. You really have to have those people at the table. So in doing that, I can tell you that I've discovered, talk about the silos, that as I've opened this conversation, suddenly I'm finding out all these programs and things that are happening that I wasn't aware of. One of them is UB keeps coming up. UB School of Management is doing a terrific new thing now where beginning this semester, they have students that are MBA management level, that they're preparing for boards. Because one of the things I said to them is, what happens with people of color is when board opportunities arise, we don't have people ready. And they say, Broderick, we can't find any. Well, I say you're not looking, right? And so the prep for those people to be ready, I was nurtured to be on boards. I was fortunate. Everybody doesn't have those connections. So this program that they put together is to identify brown people, Black people, and to propel them through getting them connected with mentors of boards so that they can participate. I'm on one of the boards that we actually took a student, and that student is participating today. I'm going to be on a call tomorrow with Blythe Merrill, who some of you might know, for OSHI. I asked the same question about what OSHI is doing. Suddenly I discovered that OSHI has a program somewhat similar. They're popping up everywhere. So what I said to them was, my next step is we need to get together at the table and bring these sources and resources together so everyone's on the right page of what's available. You won't find a lot of groundswell because not that people aren't interested, it's that they don't know what they don't know. So if we would bring these folks together, we would do better. So there really is more than just the silo. My goal is have some action. Let's kind of move the needle on that. And I believe we're going that way. So that's the good news.
Thank you so much, Broderick. Those are great comments. I'm we're going to move to question number 3. And my screen just froze, so I hope you can all still hear me. Question number 3 is actually for Dr. Gomez, Dr. Vasquez, and Emma, and it's really from the perspective of the healthcare leader. From all of your perspectives, what's the call to action, or what do you think healthcare leaders could be doing in support of health equity, racial equity, and social justice? And in addition to that, what can individual citizens be doing in the same window for call to action? What do you think people have the opportunity to do right now around healthcare? I think this time we're going to start with Dr. Gomez.
Okay, that is a big question. I think that one of the things that I believe we're doing as a community is trying to address some of the disparity in regards to COVID. We know that COVID-19 has hit hard in our communities of color, and I think as a result, we have seen not only the mental health anguish that people are feeling, but the fact that so many people are affected. At one time we saw 10 or 11% of people tested were positive, if not a little bit higher. But I think one of the things that we have done along with some of our partners in healthcare was provide testing to the community, not just for our patients, but for anybody who walked up and wanted to be tested. And it has been quite a lift, in some days being as high as 70 people showing up for testing in some of our sites. But I think along with other practices, Jericho Road, Urban Family Practice, you know, we've seen that need and we've tried to address it as soon as we were able to. Our communities have really appreciated that, because they did not want to go to the big hospitals and sit in an emergency room and wait to get tested there. You know, they wanted to come down to some place in the community, someplace that they knew, and of course where they had people who understood their language and you know, spoke similarly and looked similar to them. They want to go someplace comfortable. I think that what else can we do? There's always more challenges. I think we've met some challenges, offering that testing, offering education in regards to so many of the diseases and problems that hit our community, diabetes, asthma, two big diseases that hit our communities of color. And we have worked especially hard to get people education, whether it's nutrition, whether it's social work and behavioral health, and community health workers going out to help people, you know, understand where to go and how to get the help they need. But I think that, you know, we have to continue with that, and we have to maybe go across the lines of just healthcare, but looking at education and jobs, like Raul was saying, providing more jobs in the community. That's something that a lot of our healthcare organizations have done. We, you know, all of us have experienced that growth, and employing more and more people, it helps the community as well. So it's not just in the healthcare sector, but also in jobs, and educating them one-on-one as they come through our doors about their health and about how they can be partners with us in taking care of themselves.
Great. Thank you so much. Dr. Vasquez.
Yeah, so I think for me, you know, I'm always kind of strategizing how you can help a community. So I organize the ministers. So, you know, Reverend Pointer, George Nicholas, I would think about 4 or 5 years ago. I told them, there's a lot of feedback. I don't think it's me. Somebody's got some feedback. Yeah, thanks. And so you know, we organized the ministers to kind of learn about healthcare as an enabler. I brought in talent. We created a needs analysis, which was also part of, and Al Hammond's on the line, how we got the ministers really to play a more active role They were tired of burying people. They wanted, to help people in a lot of different ways. That piece evolved to a lot of different partnerships, and we were able to kind of guide them to the point that they've created their own entity. Churches are so powerful on the east side and the west side. And as a physician, I'm not here to tell churches what to do. I was just guiding them. And what that actually developed was a group of partnerships in a medical neighborhood model that really helped our IT. They did their work on our IT to build the data, because data and all this population health is real important to really do different things. So that relationship is really good. And I think we've been able to kind of touch a lot of zip codes and do testing and social determinants of health, everything that happened. So you have to get out and help the community. I think the ACO Jabaco, and we want to partner with everybody in the neighborhood. And with neighborhood, we have reached out to you guys. You didn't want to do that at the time, but it's so important to have a system where you can deploy and do a lot of different things. As part of the ACO, because we had a COVID response plan, we were able to, and we have 250 physicians in that system. And at the time, we were managing about 24,000 lives. Because we have access to all the data, it was easy to kind of create files and robocall the patients and really get the information to them, connect them to call centers, switch our whole model to telehealth, because that's all the things that we wanted. It created, so our impact with COVID-19, infrastructure-wise, our volume went up. We actually made more money, which is crazy. When you're trying to do God's work, God finds a way to kind of supplement these things. And we were able to really touch people's lives, get the right people testing, and opened up. We started doing testing early in the process. I mean, me and Myron were the guys that just kind of went out there. I called Myron and I have been out together for a long time. So he said yes, I say yes. And we were just like, whatever you need in terms of PPPs, we were sharing stuff just to make things happen. And our data was combined so we would know where the hotspots were. But just that collaboration is so important in the community, because there is no competition when it comes to some of these areas. There's enough market to kind of serve. We serve the same community. It was real important because of the value-based world that the future is. As an ACO, we had capital. We were capitalized to be able to do different things, I mean, our system, we're not big, but we're a $30 million shop. And we have access to people and we have access to dollars. And at the same time, it's how do we share those resources to do the things that we need? We went out, partnered with Goya. I know Goya did the craziness with their CEO and not, but we were able to get food. We bought $30,000 to $40,000 in food, and we're able to deploy, repurpose our people. So we didn't fire anybody, we maintain everyone, but then we used the vans and our wellness committee to put food out into people's community. We told everybody to stay home, but we didn't give them a guide, as to what to do. Our infrastructure was able to kind of help the other players because bigger groups weren't ready for telehealth. They didn't do a lot of, even though we had done a lot of training to really guide them in that system. All those pieces are so important, and we could learn and share resources. Now there's a third wave coming mid-September. We're gonna have a third wave. I know people don't often see that, and it's 3 waves. It's not 2 waves. And as a result of that is how do you prepare yourself to do the right thing? So, we have a mobile unit. Neighborhood has a mobile unit. It's gonna be really important to really go out and really manage the population. Rapid testing, we get it in 2 weeks. You guys are probably gonna get it in 2 weeks. We got 3,000 tests, 10 minutes. Now you can do the test, you can get the telehealth system set up, you can actually do contact tracing all at one time within 5 minutes. So all for 10 minutes. How do we collaborate and really work through that whole process together? Because it's one community. We often talk about one Buffalo, but we're not one Buffalo. How do we have an isolation index in this Buffalo of 90%. That means if you're white, 90% of the time you're not around a person of color. So we have to find ways to kind of share and do things and force us to really do the right thing, because what hurts one of us hurts many of us.
Great comments, thank you. And you pointed out a number of ways that you have gotten your reputation as being an innovator. So thank you for sharing all of that. We're going to end question number 3 with Emma's thoughts about the call to action for health leaders and individuals.
Thank you. You know, it's an honor to share my thoughts here after Dr. Gomez and Dr. Vasquez, and who've been doing this work for a long time. And I'll just say, you know, I teach a course at the UB School of Social Work about substance use. And, you know, just one small example, it's an online course, so I could just hit play and, you know, the students take the same things that they did in past semesters. But you better believe I'm going to reshape a lot of the course around themes like the war on drugs, how that's contributed to mass incarceration, about the over-policing of Black and brown communities when it comes to drug selling and using substances. And that's just an example. I think if you do have the opportunity to work either with students or at a professional school, now's the time to step into what used to seem a little bit controversial. You know, if you used to say, are they going to see this on my syllabus? Or is a student going to say this was too much? Or, you know, this is the moment. You know, fortunately, but unfortunately, COVID-19, our country's reckoning around race, things like I mentioned, the overdose crisis already, have kind of flipped a switch where it's a little bit less controversial now to really dig into these important issues that impact healthcare. And then I think along a similar line, you know, education for our organizations, training and creating space for our staff of multiple levels to have conversations. Again, I think there's a similar dynamic of what was kind of controversial and kind of like, we can't possibly talk about this at work, although we know it impacts the populations we serve. We can't possibly put this on the agenda for a staff meeting, let alone an executive team meeting and a board meeting. And what we have now is some urgency where we must do that now, or else are we really, you know, serving the community? Are we really community health centers and so forth? And it's daunting, obviously. I say this as a white person who comes from a lot of privilege, so I know it's easier said than done, but you can start small. I've realized recently you can start small, and in some cases it starts with having conversation just about terminology. And sometimes, you know, you have to recognize, you know, I'll mention we have a tremendous chief equity and inclusion officer, Ekul Menzedu, who couldn't make it today, has recognized we ought to have a resource group for communities of color to get their feedback and to provide them the support, and not only expect that individuals who come from communities of color are going to always be able to educate our white employees as well. And so, you know, we have to do our work as individuals who identify as white. So it's like education, training. And the final thing that I want to share, because I promised some of our patients that I would share this if the moment ever presented itself. I facilitate a consumer feedback and advocacy group that meets weekly. And throughout COVID-19, we've transitioned to doing it through Zoom. And I kind of thought nobody's going to show up to a Zoom meeting, but they did. And we had a conversation recently that we used to do in person, hand out a piece of paper to everybody, and people would draw images or write down keywords that represented a particular issue to them. And so we tried to do this through Zoom, and we had people take out 3 pieces of paper or just call to mind images and keywords that come to you. You don't have pieces of paper. The first issue we said, write on the first piece of paper, what comes to mind about COVID-19? And then the second piece of paper, what comes to mind about racial equity and racial justice? And then the third piece of paper, we said, what comes to mind about the overdose crisis? And I didn't exactly know where the activity was going to go. But when we were kind of going through, debriefing a little bit about what everybody had written on their paper and what had come to their minds, our people, our directly impacted people, patients, former patients, said almost the exact same thing was on every piece of paper. Racial equity, COVID-19, and overdose crisis. They said things like a little $sign with 2 lines through it. You know, they said things like the bars on a prison window. Some of them drew police cars. Some of them drew just people alone, or talked about isolation and lack of connection. And the reason I mentioned that story right now is because, again, like it's really clear that these issues that are impacting our patients are not separate. They're interconnected, they're inherently connected. And what really dawned on me at that moment is that we have a call to action here, because they were also telling me that by being already vulnerable and marginalized, they're at the greatest risk when it comes to all those issues. And so thought that was kind of interesting. And you know, one of the things I'm thinking about after leading activities like that with our directly impacted folks is including them in more. We have to try to include our directly impacted people in conversations about what the future of our program is going to look like. And I share, and a patient read this quote at the end of that meeting, and it's from Angela Davis, who is obviously many things, including an activist, a philosopher, an author, and so forth. And so we're going to keep reading this quote, and it goes, "You have to act as if it were possible to radically transform the world, and you have to do that all the time." And so you have to act as if it were possible to radically transform the world, and you have to do that all the time. And you know, even though Angela Davis is in a very different sector, being an author and a philosopher and an activist, you know, I think that theme really, really rings true for us right now. You know, we have to act as if it were possible to transform the sector that we work in, really for the benefit of our folks that are at highest risk and most vulnerable right now.
Emma, thank you. What a great way to end that question. I do think that that is something that all of us can do. And hopefully that's one of our greatest hopes for today. Before I finish up with our final question, which will be for all of our panelists for a very brief closing comment, I'd like any of our participants to start thinking about questions and push those into the chat box so we can be ready to answer questions after we wrap up our last question for our panel. So the final question is for the entire panel. It's a brief 1 or 2 minute response around where do you see the community conversation going after this excellent conversation together about working collectively on health equity, social justice moving forward? And what's one thing that you've gleaned? And where do you see one small step that your organization might take based on what you've learned today? I am going to start in the reverse order and start with Dr. Vasquez.
Yeah, so I think for me, our organization in terms of what we do, and I just want to piggyback on, you know, changing the system. I think you have to, I'm a Roman 4:17 guy. I speak it into existence. And everything I say I'm going to do, I usually do. We were able to, about 3 years ago, work with the ministers and work on finding out why medical students weren't coming into the school. We didn't have enough Black and brown population, and the numbers were really, really low. When we worked with some of the students, and we brought them back on a second look. So these are kids that already had been admitted to a UB medical school, but were not involved. You lose them. So, you know, we sponsored it. You know, G Health took on, we housed the kids, we took them out to dinner, and we showed them what the area was. And for the first time, there were 36 kids that came in, that came in for a second look, and 35 accepted a position. This past year, they had 44, the largest Black and brown group in the history of the school. No one talks about that. But it's just, how do you get involved? Because sometimes people can't just see the impact of having people that look like them. So that's one of the things that, you know, I think everyone around the room needs to kind of do, and not just in the health industry, but really even the kids that we have going through, we lose, creating a chain so that they come back and they bring so much value. I mean, so that's what I find more important. You're gonna have to give me that second question again. I got so passionate.
So where do you see the community conversation going? One thing that you gleaned from this would be the other part of the question. So what is one takeaway you have personally for what you heard today?
I think, you know, so I always think that you need to have a job model. We have to create jobs in the community, more important than anything. So how we collaborate to kind of spearhead different types of concepts, you know, the care coordination was one way to kind of really take Medicaid lives and give them jobs. And, you know, that's an area that we love because we're actually changing people's lives. We're showing them how to fish and how to do other aspects. So how do we collaborate to kind of work in that sector? And I think how do we kind of share on resources to do different things that I think can bring a lot of value, you know, to the community. I mean, we have different things that we can by way of even value-based. How do we work together and work on controlling the dollars that come into healthcare? And that's one of the areas that I've always been fighting for, because, you know, while I love insurance, Broderick, I don't love insurances. I rather, you know, have physicians and communities that can really deploy those resources appropriately, actually play in that role. We have to define our future. And I think if we don't manage those dollars in our community, managing them, not just managing the costs, you know, we can really change a lot of the things that we do and really have bigger impacts. Creating things that right now, you know, your systems aren't getting paid for, but if we were to create because they benefit the community, it's important. I mean, recipes, wellness programs. There's no reason why we shouldn't have full-fledged gyms. I mean, I know we can't open them now, but it's important. Food. I mean, just stuff that, you know, my dream, and it'll be done in the next 2 years, is I'm going to create a digital system all within every zip code that I'm dealing with. They're going to get free Wi-Fi, and we'll find a way to pay for it. So how do we collaborate on those things? Because with a good digital system, you can do remote monitoring, you can touch people, you can just keep our community involved in the world, because right now a lot of these kids are just not getting what they need. And you know, unless you, I don't know, it's just those are, I'll stop there because I'm not going to preach today.
Well, I appreciate your passion around where is the community conversation going to go, and I think those are real actionable steps. So thank you. I'm going to move to Brandy and say, so where is the community conversation going? What did you glean is important? And maybe what other organization might you ask to step in and be part of this?
So definitely what I took away from this today is that we really need to come out of those silos, and we really need to collaborate. There were so many things, wonderful things that were mentioned by so many people that would help the work and have been a response of the community. And we just haven't sat at the same table to try to work that out. And I feel like, you know, if we pull our resources together, there are ways that we can help each other achieve the goals that we want and need to achieve in our communities. As far as people who I want to partner with, Dr. Vasquez, some of his work sounded very, very amazing. Mr. Cason, talking about leadership, you know, there's a leadership program that we're working with as well with the West Side Youth Development Coalition, and we are looking for partnerships there. I mean, even when it comes to Emma Fabian and talking about addiction and harm reduction, working with the people who we have been working with in the community. That is a struggle for, you know, people are using as a way to try to self-medicate. They're trying to alleviate all the pressures that they're dealing with COVID and everything else, and to actually work with these programs to create something that is holistic. And I think that is.
Brandy, you froze a bit, but I believe you were saying that there you go. You froze a tiny, but I think you were wrapping up. Yeah. So
yes.
Thank you so much.
Thank you.
All right, we have a couple more presenters. I'm respecting that we said this would end at 2:30. We're at 2:25. I want to hop to Joelle and give her opportunity to talk about any reflection she has, who she wants to partner with, one thing she'd change. You're still muted. There you go.
We'll keep this brief. as far as, I think what's really important is that the right people are at the table and in the conversation. For what I see we need in order to move this agenda forward, we are so fortunate to have the best person as a part of this conversation, and that is Dr. Grant. Having the liaison to the mayor, I think it's really important that Buffalo have an equity initiative, and that part of that equity initiative that we get people at the table, decision makers and changers, at the table to start having this discussion and to have it be equity in general. It doesn't have to just specifically be health equity. But obviously having those that represent health equity, as a part of the, the discussion, and to, have industry leaders share best practices of what they're doing. Like the mayor's office wants to hear from you. What are you doing in your organization as it pertains to equity? Please submit to us so that we can spotlight you. We can publish you as a leader in equity for our community. Let's start making equity a big deal. Let's, let it come from that level so that people can start feeling like it is an initiative they want to be a part of. Let's start making it, putting it back to the business practice. A lot of times when I do my trainings, I tell them the business purpose of considering equity and considering diversity, and that it's just good for business. So I do believe that that's what needs to start as far as who I want to work with or who I would love to partner with. Everyone who's on this call, if there's something happening in our community as it relates to equity and diversity, please send me an email. I volunteer my time for this discussion and for this initiative. And so if there's anything happening, please invite me. I'd be there. That's it. Thank you.
Great. Thank you so much for sharing your comments. Next, Dr. Ellen Grant.
Okay, well, thank you. First of all, there's really, what I've been impressed with is the amount of good information already going on and the good work going on in our community. In terms of equity in the city, we do have a diversity director, Ms. Shatora Donovan, but I will take your comments, Joelle, and make sure that you're part of that discussion. I do also want to talk to you some more, Dr. Vasquez, because I am very, very concerned about the lack of technology for our students. So these kids are out of school. They've been trying to get connected. The Buffalo Public Schools been working. And I think we need a larger conversation about how we can make sure this is more equitable for our students of color, our immigrant, our new Americans to our community, because the gap between that population that I mentioned and white students who have, particularly in the suburbs, have more accessories is going to be even wider now. Because here we're getting ready to go back to the schools, and still we have not bridged the gap with technology for kids being able to do their homework from technology. So that's it for me.
Thank you, Dr. Grant.
Yes. I am so sorry. I'm going to have to conclude because I've got to get to another appointment on the other side of town. But I thank you for allowing me into the forum, and I look forward to working with all of you as we can.
We'll be circulating the questions to our panelists and putting them on our Facebook when we post the recorded version. So we'll be doing that offline and sharing it, and hopefully hoping to answer the questions that folks have. Thank you again for spending the time with you.
Thank you.
Have a great day. Emma, your final thoughts in this topic?
Thanks. I'll make it brief and just say, I hope these conversations continue. That's really my hope, is that they continue and that we take them to heart and bring them back to our organizations. And whether folks on the call today are community leaders or residents in the area, or, they work at a health center or in the healthcare sector, I hope it's something, I hope this is a time when people can, kind of step into their power and let those around them know what side of different social justice issues and health equity justice issues they stand on. And so one thing that stuck out to me was just Dr. Vasquez talking about, he mentioned at some point, you know, there's a lot of work that goes into the work of health centers that we're not going to be compensated for, but we know has to happen. And so it's going to take collaboration, focusing on data, telling our stories, and raising awareness and all that good stuff. So I look forward to hearing these conversations.
Great, thank you. And Broderick. You may be still.
Mute, yeah.
I think the first thing I gleaned from this, I think the most important is that we're all on the same page, which is the first way to move forward. And I think this idea, again, from the top down is really the way to go forward with some of these discussions and these initiatives, because we need leadership. And I think we have the attention of leadership right now, but we need to keep that momentum going and just keep everyone focused. Because as I mentioned earlier, that, you know, it's very easy for things like this to be sidetracked with other work. And though you mean well, you just don't stay focused on it. And I think it's really important that we continue to go forward with this kind of momentum if we really want to see change. So thank you.
Broderick, thank you so much. I think that is the powerful point, is for us to all work collectively to keep momentum going. I saved Dr. Ellis Gomez, our homegrown member, for last, and then we'll do our wrap up. And you are still muted, Dr. Gomez. There. Oh, no.
All right.
There you go.
There we go. I think it was a power from above. So I just want to say that it was a great conversation, and it was really just interesting to hear all the different things happening in our city to move forward the causes of social justice and looking and addressing health inequity. I think that I can echo a lot of the things that Dr. Vasquez said about telehealth. We face the same challenges with our patients that only had phones that had minutes and couldn't do, you know, the actual process to actually see them on video. We faced a lot of those challenges with harm reduction, and starting a couple years ago, just providing Suboxone and both mental health and treatment for addiction and harm reduction. So we have those same struggles, and we're in the same, in that same struggle with all of you. And I think that having this conversation gives us motivation, gives us energy and excitement behind the idea that together we can go forward. We can see a lot of things change. Using the mobile units, getting into communities. We have a lot of the same ideas, Raul, and we have been working alongside, sometimes in silos, sometimes we've crossed and helped one another out, as you've mentioned. We have had assistance and help from a lot of the organizations at the table today, and we have appreciated as an organization here on the West Side, as having so many different sites as well around the city, and feeling that heartbeat of need and struggle during this COVID crisis and during this time of seeing the effects of racism and injustice. So I applaud everybody who has been with us today, and it's been great getting to know some of you and the work that you've done, and I agree with Emma and with others that have said, let's not live in those silos. Let's go across the borders of our different districts and really try to work in conjunction for the greater good. Thank you.
Well, today has been, thank you all. Today has been an incredibly inspiring conversation from where I sit. I really appreciate those of you who have been able to hang out till the end. I'm going to ask you for a call to action. If every person could put one word that really describes how you feel about participating into the chat box, so we can share those when we share this recording. and mention each of you who are participants. So we would love to have your one word that is how you feel about participating, so we can share that. We are going to bring our screen share back up to kind of talk about a shared call for action that we can do together. I think that these are two areas that all of us can play a part in. We know that there's civic duty that we can help our patients and those we serve to see as important, and one is voter registration. Our vote matters. Every one of the people we serve have the opportunity to vote, and we want to help them to find a way to have that happen. And the second is the extension of the census. We are in a position where those we serve are underrepresented. And if everything we can do collectively in our organizations to help people to find their way to respond to the census questionnaire would be helpful to those we serve, bringing funding to our region and just representing the diversity and the challenges of the people we care for. There has been a number of wonderful one-word comments and a couple of word comments that actually are very inspiring for us. I just want to say a final, we don't have time for Q&A because we've gone over on time. We want to respect how generous you've all been with hanging out with us. So we will take any questions that are in the chat box and put it up on our Facebook page when we share the recorded version of this. So, and if you want to forward other questions on to us, we'll do our best to get the panelists to respond to those. First, just my most humble thank you for the expertise of all of the people who participated as panelists. Many, many thanks. You really have shown what amazing things are going on in the community, what a brain trust we have right before our eyes here in the region, and the opportunity for us to collaborate going further. And I want to thank all of you who took the time today to participate and listen so you can go out and share the message. So we are proud to be part of this social justice movement, and we're proud to partner with so many more. So I want to thank you all again. And we will see you soon at our next conversation.